Now I'm going to cover the essential questions for Chapter 10 in Womble's mood disorder. Number 1, the therapeutic blood level for lithium is 1.0 milliequivalent. Study your charts and see how you can put this together. Number 2 is define clang association. That is defined on page 143, so please read it, but it's words strung together in rhyming phrases that have no meaning, and they give a good example on that page. Number 3, how do you ensure adequate nutrition for the patient in the manic phase? And finger foods would be a main intervention for that. Number 4, what neurotransmitter deficit has been implicated in depression? That's serotonin, because there's a whole class of medications. ECT, a post-procedure manifestation, is memory loss or memory deficits, unfortunately. Some people still think it's worth it. Number 6, define anhedonia. It's the inability to express pleasure, or to experience pleasure, rather. Number 7, suicidal erosion, and we've outlined several. I've outlined several here. Suicidal erosion, suicidal gesture, suicidal threat, and suicidal attempt. The last two are the easier ones. These are defined on page 144 and 145 of your Womble text. Back to the first one, suicidal erosion is long-term accumulation of negative experiences that can lead to suicidal thoughts. They believe that the personality is eroding or declining to the point that they might think of suicide. A suicidal gesture is actually an action that indicates that they may be serious about it, that they may be about to carry out a plan. A suicidal threat is simply the statement. A threat is a statement of intent to harm themselves. A suicidal attempt is the possibility of success as a reality. They're actually trying or expressing that they're trying to kill themselves. Number 8, what electrolyte is apt to be depleted in the body when taking lithium? That's sodium. Number 9, patients taking MAOI should avoid tyramine, which is contained in the foods listed on page 101 in the new ATI review book. It includes cheeses, beer, wine, and we just learned protein dietary supplements. Number 10, patients taking TCAs, tricyclic antidepressants, should avoid consuming alcohol. Number 11, norepinephrine is the neurotransmitter indicated in mania. Epinephrine, think of a heightened hyper state. Number 12, which class of antidepressants is fatal in overdose? That's TCAs also. Number 13, the patient undergoing ECT, electroconvulsive therapy or shock therapy, will experience a seizure. So again, you have to make sure they sign a permit, and there's a lot of nursing duties because of the danger of this situation. Number 14, what is the priority nursing diagnosis for suicidal thoughts? It's risk for violence, self-directed, related to suicidal thoughts, and always we think of the potential for violence when we hear the word suicide. Number 15, an expected outcome for the patient with depression is identify personal strengths. If we can get them to tell you about their troubles, but then also highlight that they do have some things going for themselves, some personal strengths, that would be wonderful. Number 16, a severely depressed patient must be watched closely for signs of impending suicide. You would not expect that patient to have increased appetite. 17, suicidal ideation is a level of risk for suicide that entails a thought that indicates the person's desire to do self-harm. Suicidal ideation, a level of risk for suicide. They're having ideas about it. Dysthymic disorder, in number 18, is less severe than major depressive disorder, but tends to be more chronic. 19, the bipolar patient who has 5 mood shifts within a year, alternating between mania and depression, is experiencing rapid cycling, more than 4. 20, define incongruent. It's not corresponding in structure or content. I think of it as not fitting, or it shouldn't fit. And an example would be laughing about a death. We don't expect that. That's incongruent. And that is the end of the discussion of the essential questions for Womble's Chapter 10. Thank you.